You're right. I said, I can't tell you what to do, but I know what I would do. I would stop because it's a toxic poison. It's cytotoxic. You know what that means? Poisonous to cells. Yes, we want to kill the bad guys, but it also kills the good guys. Whereas we live in an incredible body with an inbuilt ability to heal itself, and it will heal itself when you give it the right conditions. So working with the body is important. But I also must stress that we must listen. If you're bleeding from the vagina, if you're bleeding through a man as he urinates, if you're bleeding from the colon, the body's saying, excuse me, there's a problem. Can you do something? And unfortunately, many people do nothing, and then by the time they are discovered that there is a tumor or something, then it's quite advanced.
What if I told you that one small sign could be the difference between life and death? What if your body is already whispering warning signals, but you're not listening? Every 1 in 8 men will be diagnosed with prostate cancer in their lifetime. It is the second leading cause of cancer deaths among men, and yet it's preventable. The secret? Recognizing the warning signs early and making key lifestyle changes. Starting today, in the next few minutes, I'll reveal prostate cancer symptoms you should never ignore and how to naturally protect yourself from this silent killer. Because your health, your future, depends on it. Your prostate is small, about the size of a walnut, but when it's in trouble, your body will try to tell you. Let's break down the red flag symptoms that demand your attention. Number 1, difficulty passing urine. This symptom can manifest as a feeling of needing to urinate, but being unable to do so. Another sign might be difficulty stopping once you've started. Since the prostate's around the urethra, even a small tumor or enlargement can disrupt urine flow. It's worth noting that an enlarged prostate is common as men age, and similar symptoms can occur without indicating cancer. However, it's essential to consult your doctor for a proper diagnosis. Number 2, pain while urinating. Pain or a burning sensation during urination can be a sign of a cancerous tumor pressing on the urethra. It can also indicate non-cancerous conditions like prostatitis, prostate inflammation. Regardless of the cause, this symptom warrants a medical checkup. Number 3, blood in your urine. While less common, noticing blood in your urine, even a slight pinkish tinge, is a potential warning sign. Book an appointment with your doctor immediately if you observe the symptom. Number 4, pain in your lower back or upper thighs. Prostate cancer often spreads to the lower back and pelvis. Pain in these areas may feel like a deep, persistent ache rather than typical muscle pain. If this discomfort lasts for an extended period, consult your doctor for an evaluation. Number 5, blood in your semen. This symptom may appear as a slight pinkish tint in your semen. Although it might seem minor, it's important to inform your doctor if you notice this change. Number 6, difficulty getting or maintaining an erection. Erectile difficulties are one of the most sensitive symptoms for men to discuss, yet they can be an early warning sign of prostate cancer. A tumor may interfere with the blood flow needed for an erection. Other conditions, such as an enlarged prostate or benign prostatic hyperplasia, BPH, can also cause a symptom. Regardless, seek medical advice if you experience this issue. It's important to remember that the symptoms told you before can also be caused by non-cancerous conditions, such as urinary tract infections, UTIs, or benign prostatic hyperplasia, BPH, a non-cancerous enlargement of the prostate. Your doctor will assess your symptoms and provide an accurate diagnosis. Let's talk about stakes. Prostate cancer is the second leading cause of cancer death in men. But here's what they don't tell you. 90% of cases are treatable if caught early. Yet men wait. They shrug off symptoms. They avoid doctors. And by the time they act, their options shrink to surgeries, radiation, and prayers. Imagine your family's faces if you became a statistic. Imagine the regret of thinking, I could have stopped this. But this isn't about fear, it's about hope. Your body is a fortress, and with the right tools, you can fortify it. Men in Western countries have much higher rates of prostate cancer than men in Asia. While no one can definitively explain this phenomenon, experts suspect differences in Eastern and Western diets are to blame. Poor eating habits and diets that heavily rely on fats and animal proteins can cause DNA damage and lead to cancer. Now, here's the good news. You can fight back. Even men who are already at greater risk due to age, race, or genetics can reduce their chances of developing prostate cancer by adopting healthy diets and lifestyles. Simple, natural changes can drastically reduce your risk. Here's how. Number 1, eat like your life depends on it. Reduce fat intake. Eat less trans fats and saturated fats. Focus on healthy fats such as omega-3 fatty acids from nuts, seeds, and fish. Omega-3s are a type of essential fatty acid, meaning you must obtain them from your diet. Some food sources of omega-3 include seaweed, flaxseed, chia seeds, and fatty fish. Examples of fish highest in omega-3 include mackerel, salmon, and sardines. Eat more fruits and vegetables. Incorporate a wide variety of produce, including plenty of leafy greens. The antioxidant lycopene, which is plentiful in cooked or processed tomatoes, watermelon, and pink grapefruit, has been shown in some studies to slow the growth of prostate cancer cells. Cruciferous vegetables, like broccoli and cauliflower, contain a compound called sulforaphane that may protect against cancer. Add green tea and soy in your diet. Clinical trials have suggested that soy may lower PSA levels, whereas green tea contains catechins, potent compounds that help slow prostate cancer growth. So that green tea may help men who are at high risk for prostate cancer lower their risk. Avoid charred meat. Charred meat, from frying or grilling at high temperatures, may produce a chemical compound that leads to cancer. Ditch the processed foods. Processed meats and junk food fuel cancer growth. Swap them for whole, nutrient-dense foods. Your prostate and your whole body will thank you. Number 2, maintain a healthy weight. Obesity can be a risk factor for developing more aggressive prostate cancer. In general, losing weight and maintaining a healthy weight as you age can help reduce your risk of cancer and many other health problems. Number 3, get regular exercise. In addition to helping you achieve a healthy weight, exercise can reduce inflammation, improve immune function, and fight some of the negative health effects of a sedentary lifestyle, all of which can help prevent cancer. Just 30 minutes of daily exercise slashes risk by 20%. Walk, lift, swim, just move. Regular exercise reduces inflammation and improves blood circulation, both of which protect your prostate. Number 4, increase your vitamin D. Most people don't get enough vitamin D. It can help protect against prostate cancer and many other conditions. Vitamin D-rich foods include cod liver oil, wild salmon, and dried shiitake mushrooms. Since the sun is a better, more readily available source of vitamin D, many experts recommend getting 10 minutes of sun exposure without sunscreen every day. Doctors often recommend vitamin D supplements. However, you should talk to your doctor before taking any vitamin or supplement. Number 5, stop smoking and drink less. Quitting smoking can improve your health in many ways, including lowering your cancer risk. And if you drink, do so in moderation. Some studies suggest that red wine has antioxidant properties that may benefit your health. Number 6, consult nature's pharmacy. Increase zinc intake. Zinc is crucial for prostate health. Snack on pumpkin seeds, cashews, and almonds to boost your defenses. Several herbs have been traditionally used to support prostate health. You can use saw palmetto, stinging nettle, Pygeum africanum, cranberry, and small willow leaf. These herbs have been used for centuries in traditional medicine to alleviate pain and inflammation in the prostate. They also may improve urinary flow and block the conversion of testosterone to a hormone that contributes to prostate enlargement. If you want to consult nature's pharmacy and looking for herbs that may boost your prostate health and how to use them, check out this video in which Barbara O'Neill reveals 2 best herbs that your prostate need. Number 7, stay sexually active. 2 studies appear to show that men who have a higher frequency of ejaculation, with or without a sexual partner, were up to 2/3 less likely to be diagnosed with prostate cancer. Studies are ongoing, but some experts theorize that ejaculation clears the body of toxins and other substances that could cause inflammation. Now that you know the symptoms, don't ignore them. If you've experienced any of these signs, see your doctor today. And if you're serious about preventing prostate cancer naturally, start making these simple changes now. Adopt these tiny habits with life-saving impact. If you found this video helpful, hit that like button, share with a friend who needs to hear this, and subscribe for more life-changing health tips. Your body speaks. It's time to listen.